Hello everyone, my name is Ping Wang from Temple University. It's my great honor to be here to present my research, Effects of Connective Tissue Graft Following Immediate Implant Placement at Maxillary Central Incisor Site. The maxillary central incisor region is of major importance in aesthetics and patient satisfaction. However, it is also a common area for aesthetic complications with immediate implant placement. Connective tissue grafts are frequently used as a remedy therapy. As previously proposed by Dr. Levine, CTG placed under the buccal flap is recommended as one of the 10 keys for immediate implant placement in the aesthetic zone. To the best of our knowledge, there is no study in the literature on the use of CTG following immediate implant placement at maxillary central incisor region alone. The aims of this retrospective study was to assess at maxillary central incisors the effect of using CTGs following immediate implant placement. 28 patients who had a single maxillary central incisor replaced by immediate implant placement with at least 1 year in function were included. The central incisors were extracted using minimally invasive technique and implants were placed in anatomically correct position and the buccal gap were grafted with inorganic bovine bone. Depending on whether CTG were placed or not, they were divided into two groups, the CTG group and no CTG group. Clinical aesthetic assessment were conducted using pink and white aesthetic scores by 4 prosthodontists who were not involved in the treatment and were blinded to the groupings. A calibrated examiner assessed the thickness of the buccal plate on the CBCTs and conducted a measurement of mid-buccal mucosa level at the implant site in comparison to the contralateral central incisors. All patients participated in a subjective outcome questionnaire. For the aesthetic scores, there is no difference of pass-west between the two groups before the treatment. After treatment, the total pass-west score was significantly higher in the CTG group than the non-CTG group. The frequency of sites exhibiting pass equal or larger than 6 following immediate implant treatment was 94% in the CTG group compared to 73% in the no-CTG group, while the corresponding frequency of WAS equal or larger than 6 was 94% in the CTG group and only 64% in the no-CTG group. There is no significant differences of buccal bone thickness between the two groups when measured at the implant shoulder at 2, 4, and 6 millimeters below the implant shoulder level. When compared to the contralateral natural tooth, there is no significant differences of the mid-buccal mucosa level between the CTG and non-CTG groups. However, when comparing the mucosal level alterations over time, that is before and after treatment at the implant site, the CTG group lost about 0.15 millimeter, while the no-CTG group lost about 0.8 millimeter, with statistically significant differences between the two groups. For the patient-centered outcomes, both groups reported high levels of satisfactions, regardless of the topics and the pass-west outcome. In conclusion, within the limitations of this study, it showed that placing a CTG following immediate implant placement promoted better aesthetic outcomes at maxillary central incisor sites compared to the non-CTG group. However, CTG did not improve buccal bone dimensions or the mid-buccal mucosa level when compared to the contralateral natural tooth. Patient satisfaction showed overall high aesthetic scores regardless of the study group, topic, and pass-west outcome. Thank you so much for your kind attention.